Hi everyone. I just saw a video recently about a mother whose child died from fentanyl overdose, and it was just a 2-year-old baby. She didn't know how her baby died or how the baby got the fentanyl in her system. But here she had given her child for child care to the child's paternal grandparents, and during that time, the health incident could have occurred. But here are the possibilities of some of the reasons why fentanyl can be fatal, not just to humans and adults, but to small babies as well. Fentanyl is usually available in these three forms. It's in either available in the form of a patch that looks like a large band-aid that is applied in the body of patients who are experiencing pain. Now, if a child were in a house where the grandparents or even the parents had left around some fentanyl patches on the table or on the dressing table, and the child was moving around the home and just curiously saw the patch, they might mistake it for a band-aid, and if they were used to playing with band-aids, they could apply it on themselves if they are agile enough. Otherwise, if someone had, say, accidentally thrown or actually thrown a patch in the dustbin, and the child, while playing around, picked up the thrown away used patch, again they might think it is a band-aid and might want to apply it on themselves for mimicking their parents or elderly people in the house. And if the child did that, or if someone applied it accidentally on the child, then there are high chances of this fentanyl, even from a used patch, getting absorbed by a child, and it could be fatal for a child. In fentanyl packaging, usually it's written keep away from children, and there are different steps provided on how to dispose of the patches and other boxes safely. But sometimes when people don't have kids in their home, they may not be as mindful as the instructions provided to them in the box or provided it to them by the pharmacist, or as a result, when one gets used to not having any children around, they could be careless with medicines in the home. The other kind of fentanyl that is very popular in the market is the fentanyl lozenges, which are twice the size of our fingers and length and breadth both, and they look like white candy. And that too, because it's a lozenge, it has a large sugary content in it. Any kid seeing a lozenge lying around in the home might think that it's candy and could easily pop it in their mouth. And again, fentanyl as it is pretty toxic even to adults if they have used it long term, and they could get fentanyl related overdose. So likewise, a small 2-year-old baby whose size is so much smaller in than an adult has even 10 times 20 times greater potential to be overdosed from even a small lick of a lozenge, or even a small bite from a lozenge. Then the third type of fentanyl is the injection. Again, I don't know if anyone was unmindful of leaving some injection syringe or a vial around, which the child could have thought is a drink and could have tasted it. That is another way the child could have been poisoned. And then there are these two additional ways that could happen, which could lead to accidental poisoning, not from direct exposure but from indirect exposure, because fentanyl can cause side effects like sweating, dizziness, drowsiness in a human being, if and many other symptoms that could lead to respiratory problems, cardiac problems, brain problems, functional problems. And say someone was using fentanyl for a long time, and they have been using it for a few years or a few months, their body could have enough fentanyl accumulated in the body such that anytime they sweat, the fentanyl, some amount of fentanyl or its metabolites could be sweating out from their armpits or from their hands if they have sweaty palms. Now, say such an adult who uses fentanyl and regularly and has some fentanyl in their system already for a while, and they also sweat, or they have been wearing some sweaty clothes and they are playing with a baby. Now, even if they hold the baby in their hand for a few minutes or a few hours, or they are just giggling around with the baby or holding the baby, when we hold a baby, we are touching the baby's hands, shoulders, necks, legs, and now any of these, while holding the baby, could result in any kind of fentanyl that was there in the sweat of the human being to get transferred from the person holding the baby onto the baby's hands, baby's legs, baby's face, baby's neck. Because if you had a sweaty palm, even if you were not sweating when you were holding the baby, but you had sweat earlier in the day, or your clothes are a little bit sweaty and the baby is held like this, the baby can absorb anything from your clothes, anything from your hands, and as a result, also there is a possibility of the baby having absorbed large amounts of fentanyl from the adult holding the baby. And the longer a person has used fentanyl in their life, there is a higher concentration of fentanyl possible to be present, or its metabolites possible to be present in the sweat of the person who uses fentanyl. Now, the third way, or another way, the fentanyl metabolites could cause cross contamination, or fentanyl itself can cause cross contamination, is if someone threw away their unused fentanyl in their water system or in their garbage disposal, but because of some reason or the other, if there is a lot of fentanyl use in a particular area of a locality of, say, a particular city, and in that locality, if enough people have been using fentanyl, or if enough people have disposed fentanyl over a long time of use, what can happen is our groundwater and earth could be contaminated with fentanyl or its metabolites. And if people have been living in those housing for many decades, it's possible that the pipelines might be cracked enough that when the water supply is received from the municipality, those pipelines could have cross contamination from fentanyl present in the underground water supply of that area, or underground earth contamination, which has led to eventual water contamination of the area. And this contaminated water, if it has mixed with your drinking water supply, and that drinking water supply has even trace amounts of fentanyl, and you're using that water for bathing, washing clothes, drinking, cooking food, then your food is contaminated, then your drinks are contaminated. If a baby was given a baby formula mixed in a water supply contaminated with fentanyl or its metabolites, that way too the baby could have got a exposure to the fentanyl. And whether this happened at the parents' place, at the grandparents' place, one can't say, because it depends. Even if the parent was living in poor quality housing where maybe illegal drug activities are going on, or even some legal drug use is going on, any of those factors could have led to cross contamination of the water of that place, and then eventually led to, even if no one in the household itself is using any fentanyl actively, just by living in a neighborhood with fentanyl in the environment can lead to a person having exposure to fentanyl from the water supply of their homes. So, because of which, if this child had lived in a home for a long time where fentanyl was there in the water supply, or was exposed to interacting with adults who are using fentanyl, be it at their parents' place or the grandparents' place, that child could have had long-term exposure or a short-term exposure, depending on what actually happened with them. If it was short-term exposure, it was likely directly from the exposure to the patches or the lozenges, and if it was long-term slow exposure to the fentanyl, it was either from the sweat or from the clothes or from the water supply of that area. So there are so many ways in which a medication can this is a legal medication, but even though it's a legal medication, it's a potent medication, and it's toxic as it is for those adults who use it regularly long term, and can lead to drug overdose related deaths. But even if a small child uses it for a short term, it can again lead to deaths in children. That's why it's important that when adults are using medications in the home, be it how they dispose the medication, be it how they are using the medication, where they are storing the medication, they should likely try to hide it away from their kids, because medications aren't candy, though to kids they may look like candy, because many of these medications look very sometimes very fancy, sometimes like a candy, sometimes like something they can play with. And if they find, and if the grandparents are normalizing use of medications, or even the parents are normalizing use of certain medications around the children, to the child it's a fascinating experience, and even just by trying to mimic their parent or grandparent, they could end up with a accidental overdose. Even and the overdose wouldn't happen just because the child ate multiple tablets or multiple lozenges or something. The overdose can happen even with the normal adult dose, or even with a tenth of the normal adult dose, because a child's body is not made to handle these medications. So any kind of medication people use in their homes, people should start becoming mindful of the medications they use, so that, and also they should be mindful in storing the medications in places where kids can't tamper with it. And when they're disposing of any unused medicine or remnants of patches, they have to make sure they follow the instructions that are given in the packaging label itself on how to dispose it of safely. And even if we are mindful and safe, sometimes despite that, accidental deaths can happen if we have used some drug long term, and its side effects, though it might not be impacting the adult, can end up impacting the health of a child. I hope this video was beneficial for you, and if you have any questions on this topic, please drop a comment. Thank you.